Hello everybody. I am now going to demonstrate what a gliding brow lift is for those of you who don't know or never heard of it. And so here is my pretend patient. These are the eyes. The brows are a little on the low side, and here's the hairline. Okay, patient is pretend sedated, general anesthesia. And for some, it could be done under local anesthesia. So first what I do is I put a lot of local and I blow up, I go right under the skin and I put a lot of local. Puff it up almost like a dolphin fish, just a lot of local. Let it sit there for a good 10 minutes. Then I make only 4 small incisions right at these green marks. 4 small incisions. So this is the skin, this is the brow, and if we were to lift this up, this is the bone of the forehead, and these are the muscles that lift the brows, and these are the muscles that give you the scowl lines, the 11 lines. And the idea is that we want to move the brow up like this. So I haven't done any surgery yet. I've just done the 4 small incisions. These 4 small incisions, that's it. That's the only incision that I make for this brow lift. Now that the local has been in effect for at least 10 minutes, then I take a very blunt instrument like this and I go through these little incisions and I get under the skin. I separate the skin from the underlying muscle like this. I get all underneath through these 4 incisions. I separate the skin from the underlying muscle. Now I can go across the whole forehead, or I can just do the lateral part, or I can just do the middle part. Usually I do the whole forehead. Again, only 4 small incisions, and I've separated the skin from the underlying muscle. So then I can do this. So the next part of the procedure is to glide the brow to the position where I want. And I go a little bit more because I have to do a little bit of an overcorrection. Now, this would normally all be covered by skin, but just to give you an idea of anatomically what's going on is I'm sliding the brows, gliding them to where I want them, and then I overcorrect a little bit so that the brow is now positioned higher with relationship to the underlying muscle. Then the fixation, this is the hemostatic neck. So then I take a suture and my assistant holds the skin in place. And I brought it a little bit higher than I want because there's going to be an eventual relaxation. And then I take what's called a hemostatic net and I suture the skin and the muscle together as a unit. And I do multiple rows. All right, so I'll do one here, then I tie it off. And then I will do another one over here. So the skin and the muscle is sandwiched together, and these are not super tight sutures, just gentle compression, so the skin and the muscle will stick together. And this is what helps those horizontal wrinkles get better. So when I'm done, there'll be rows like this. So the skin is attached to the underlying muscle in a higher position. These sutures stay in for about 3 days. They're removed, they don't leave any marks, and this holds it in position. There's just a little bit of relaxation afterwards. They're not very pretty to look at, but they're only there for 3 or 4 days, and we put a nice dressing on them. That's a gliding brow lift.